Approach to a patient with chest pain. Let's begin our approach using P3 Maftosa. 3 Ps. Present complaint, past complaints, personal history. Let's start with present complaints. Do you mind if I ask you what has brought you into hospital here, or how have the chest pain been affecting you? Can you please tell me more about it? Specifically, ask about pain questions using Socrates PDA site. Where exactly do you feel the pain most? Usually, crushing central chest pain is of cardiac origin, whereas epigastric pain is due to peptic ulcer disease. Onset: how did the pain start? What were you doing when it started? Determine it is sudden or gradual in onset. Is it the first time, or were there previous episodes? If there were similar episodes in the past, ask, when was the last episode? Character: can you please describe the pain for me? As crushing or squeezing, pressure like chest pain has a cardiac origin, whereas sharp, pleuritic type chest pain may be due to pericarditis, respiratory, or musculoskeletal pathology. However, sharp, burning-like pain is due to gastroesophageal reflux disease, and a band-like shooting pain is due to nerve root involvement. Next, ask about radiation. Does this pain go anywhere else? If the answer is yes, then ask where it goes. Cardiac pain has typical radiation to the left arm, neck, or jaw, and pain radiating to the back may be due to pancreatitis or aortic dissection. Associated symptom. Let's discuss differential diagnosis of chest pain and how to rule them out by asking simple questions. Regarding cardiac pain, ask about sweating, pallor, racing of heart. Have you ever wake up at night breathless? How many pillows do you sleep at night? Have you noticed any swelling in your legs? 4. Pericarditis. Ask about any recent flu-like illness. Next, ask about respiratory chest infection. Ask for any fever, cough, quantity, and color of phlegm. Does it ever contain any blood mixed in it? Furthermore, pulmonary embolism. Ask about any blood in the phlegm, any calf pain or swelling, any recent travel or history of immobilization like any recent surgery. Moreover, malignancy. Ask about any recent weight loss, cough, night sweats, any lumps or bumps. Next, ask about peptic ulcer disease. Have you ever had vomiting containing blood, or any black-colored stool? Whereas, 4. Gastroesophageal reflux disease. Ask, acid taste in your mouth, burning sensation in the chest, difficulty in swallowing, nausea, vomiting. Regarding musculoskeletal pain, ask for any recent trauma. Additionally, 4. Nerve root pain. Ask for any numbness or weakness of limbs and control of bowel or bladder. History of cancer is additional supportive evidence for it. Exacerbating factors. Does anything make it worse? Pain that worsens on exertion reveals cardiac pathology, while pleuritic type chest pain suggests pericarditis, respiratory, or musculoskeletal origin, and peptic ulcer disease or gastroesophageal reflux disease pain exacerbates by eating. Furthermore, pain due to pericarditis, pancreatitis, and gastroesophageal reflux disease worsens by position. Further, ask about relieving factors. Does anything make it better? Cardiac pain improves by rest and the use of nitrates. Ask, have you tried any analgesics? As pain due to pericarditis, respiratory or musculoskeletal origin improves with painkillers. Peptic ulcer disease or gastroesophageal reflux disease pain gets better with the use of antacids. Scale. If I was to give you a scale from 1 to 10, 1 is the lowest, and 10 is highest, how do you scale the pain? Progression. Has the pain changed over time? Is it the same, getting better or worse? How is this pain different from previous episodes? Duration. How long is it present? Anything else? Before the start of questioning about specific diseases that might result in chest pain, let's have a quick look at the possible differentials. Past complaints. Similar complaints. Has anything like this has happened to you? For how long? What did you take for it? Is it well controlled? Are you taking any medication? Do you have any long-time medical condition? If yes, then ask how long. Is it well controlled? Check for any cardiovascular risk factors like diabetes, hypertension, hypercholesterolemia, or any previous myocardial infarction. Ask about hospitalization, saying, have you ever been hospitalized? If the patient says yes, then ask for what purpose. Recent surgery is a risk factor for pulmonary embolism. Next step is personal complaints. I'm going to ask you a few personal questions, and whatever you say will be confidential. Smoking. Do you smoke? If the patient says yes, then ask, how many cigarettes do you smoke a day? For how long have you been smoking? Tell me about your sleep. Do you drink alcohol? If the patient says yes, proceed by asking, what do you prefer to drink? How much? For how long have you been drinking like this? How is your appetite? Recreational drugs. By any chance, do you take recreation drugs? If the patient says yes, then proceed by asking, sorry to ask you, but what do you do? How do you take it? If injecting, ask, by any chance do you use a new needle all the time? For how long you are doing this? Do you use any other recreational drugs? Weight change. Have you been weighing on the higher side? If yes, ask about bowel habits. How often do you open your bowels? Have you noticed any change? Sexual history. Are you sexually active? If the patient says no, then ask, have you ever been sexually active? If the patient is sexually active, then ask, sorry to ask you this, but are you in a stable relationship? For how long? Are you on any contraception? Did you travel abroad before your symptoms? Did you have any sexual relationship there? If the patient is a woman, ask about 4P, period, LMP. When were your last periods? If more than 4 weeks, then she might be pregnant. How many days did they last? Are they irregular? Do you get pain? Any abnormal bleeding? Are you on pills? Oral contraceptive pills are a risk factor for pulmonary embolism. Pregnancy. If she is not active, so she is not pregnant, then ask, have you ever been pregnant? Duration of pregnancy, mode of delivery, how many children do you have? Any miscarriage or abortion? Any complications before, during, or after pregnancy? Pap smear. When did you have your last Pap smear? What was the report? Was it normal? If it is abnormal, have you booked an appointment with GP? Allergy. Are you allergic to any particular substance? Family history. For carcinoma, history in a family is essential. Ask, I am very sorry to ask, but anyone in your family is diagnosed with a sinister disease, cancer. Also, ask for ischemic heart disease or hypercoagulable state like thrombophilia. Travel history. Have you recently traveled abroad? Occupation history. What do you do for a living? Ask about the nature of the work. Does it involve exertion that might precipitate cardiac-type chest pain? Ask, how much do these symptoms affect your daily living? Whether he has to take time off from work due to pain? Social history. Where do you live? Whom do you live with? Do you drive? Inquire about the functional status of the patient, particularly the impact on the activities of daily living. Are the chest pains affecting your relationship? Anything else you want to tell me? Now, at the end, take your time for an impression. Then, turn to the examiner and say, based upon my history, my probable diagnosis is this. My differentials are this, this and that, and I should have ruled out this and that. Thank you for watching. Stay connected and subscribe to this channel for more interesting medical professional videos, and good luck with your exam.